Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. Today we are talking golf. We're talking about shoulder pain and golf. We're going to go over some key concepts when it comes to shoulder pain in golfers. We're going to go over some key biomechanics that are related to shoulder pain in golfers, and then I got some exercises, some drills, just brief, just a couple exercises that can kind of get the ball rolling in addressing some of these limitations. But we're going to talk about the common limitations, what they look like, how we test for them, and then again just two exercises that begin, to start to address some of those issues. And we'll go over some details of the different injuries and sort of why they are happening as in terms of global movement biomechanics and the demands of the golf swing. Okay, so understanding the rotator cuff and other shoulder injuries. When it comes to the rotator cuff, we can develop injuries as young athletes, as older adults, and even older adults can start to develop some rotator cuff injuries, which are typically in the form of tendinitis or a tendinosis, right? So falling under the tendinopathy family. What this is where the muscle connects to the bone. These tendons, they're not very well nourished, and these can start to get irritated either through internal stresses of just using these muscles in certain ways, or they can be kind of pushed up against you from other bony architecture, like the acromion process in the shoulder, for instance, or some other bony prominence where we can start to kind of injure these tissues over either short-term acute onset or just from a long-term overuse, maybe lacking mobility throughout a lifetime really starts to injure these tissues. It takes a toll on them, and then we get these what are now become chronic pain and injury to the rotator cuff muscles, typically at the tendon. Now we get some other injuries at the shoulder. It could be labrum tears are not uncommon, and especially with previous athletes that have played some other sports, but even in the golf swing, you can develop some labral issues. Not to mention any sort of arthritis in some older golfers, and even some younger golfers would be surprised. Any sort of impingement, and then just a shoulder complex stability or mobility issue where we're not getting those muscles to centrate that joint. And again, we can start creating our own sort of impingement, not because of a bony architecture change where we have increased bony prominences, but just because the muscles are not centrating or keeping that joint and moving it in that joint as we globally move the arm in different directions. And when that happens is then it can start to slide and glide into different bony areas and create that impingement and different things like that. So again, when it comes to the rotator cuff, we have some muscle issues. A lot of times though it's a tendon issue, and then supraspinatus and infraspinatus most common. And then we have some other issues, maybe at the labrum, arthritis, things like that can also play a role. So these are all things we need to figure out which one is it that we're working with, because we will do some different things regarding it. But moving forward, let's just talk about how can we prevent these injuries by taking a kind of a global approach to mobility and stability. Okay, so we need to understand the range of motions that we need from the shoulders and where issues can arise if we're lacking them. So what this is we need internal rotation and adduction, or where that shoulder and arm is coming across the midline of our body. We need that in the lead side arm. Okay, we also need some flexion from there. On the backside arm, we really need external rotation, especially if you want to start doing some of these swing drills that focus a lot on that back arm. If you want to start hitting these positions like Tiger does, well, we definitely need full access to that backside shoulder external rotation, and then abduction, where that shoulder is coming away from the midline. Check out this video here that I have up on YouTube, which will give you some visuals of what I'm discussing here. What do we need from the shoulders in the golf swing? Okay, in the golf swing, backside shoulder, what we need here is to get into external rotation and some abduction or abduction. What that looks like is we need the shoulder to be able to do this, and we need it to be able to do this. From the front side shoulder, what we need here is for the shoulder to be able to adduct, and we need flexion and internal rotation. So what that looks like there is we need the shoulder to be able to come across the body, we need it to be able to internally rotate, and we need some flexion. Okay, when we're testing clients and patients at Integrated Rehab and Performance Center, again, with our golfers, we really want to look for these different mobility aspects, right? So with that lead side shoulder, in this case my left arm, Again, we're looking for shoulder adduction and shoulder internal rotation and flexion. So here we're testing that adduction, the ability for that arm to come across the body. Obviously, really important. Now, it's much easier. We really need to do this with a clinician who is holding and pinning that scap down so we can see how much true shoulder adduction is coming from that shoulder joint and is not coming from compensation of maybe a protraction or a forward protrusion there of the scap and other compensations, right? So typically, most people are very limited in this motion, actually, and it leads to all sorts of compensations throughout the golf swing, right? So in this case, we pin that shoulder blade down, and then we see how far we can come across to the midline there. Here for shoulder internal rotation, again, same thing. Much easier done passively with a clinician. Again, we're looking to see how far can we get that hand towards the ground without that shoulder starting to pop off the ground. Again, we want to see about 60 degrees there at least, and then shoulder flexion, we're just bringing that arm up overhead and we're seeing how far can we get it before we start to see either a rib flare or other compensations like elbow bend and different things at the shoulder. So there I'm demonstrating that rib flare where we would stop the test right where we start to see that happening. Again, we like to see about 180 degrees, 170 degrees of shoulder flexion overhead. But again, to get true shoulder flexion, a lot of people are actually very limited when it comes to true non-compensatory shoulder flexion where we're not getting any help from any other joints. Now this backside arm, we want to look at shoulder external rotation. We can see that happening here. Again, we want to stop once that shoulder starts to come off the ground and we start to change that angle or the plane of the arm out to the side there at 90 degrees of abduction. And we're looking for 90 degrees of external rotation there. Again, really important to be able to achieve a good top of the backswing position, especially when we're working on certain drills that are asking us to kind of drop into that slot. Again, if we don't have shoulder external rotation, it's going to be very difficult to make that happen without compensating elsewhere. And then the last thing, we are just looking at shoulder abduction, and this is easier done on the edge of the table there. And all these we'd really do with a clinician, doing it passively, so the patient just kind of has to hang out there, and we move them through this motion, and we stop when we start to see the different compensations coming up. In this case, usually it's when that sternum starts to turn towards the arm as we're moving there, just like that as I demonstrate there. And we're looking for at least about 45 degrees shoulder abduction. And again, not surprising, lots of people are limited in this range of motion here. So how are golfers getting into the backswing if they're so limited in a lot of this range of motion? That being lead side adduction, lead side internal rotation, and backside external rotation. Well, they're compensating through other joints. So they'll do anything to make it feel like they're in the backswing, at the top of the backswing, make it anything to look like up here we're in the top of the backswing, when in reality, what we're doing is we're losing our angles here at the ankles, knees, and hips. We're using extra thoracic rotation if we got it, but again, most golfers don't actually, they usually don't have enough. So what they're doing again is just shooting their hips forward, and then they're doing anything just to get what feels like a good top of the backswing here. But then we've lost all our angles elsewhere, and now we're chunking balls, we're slicing balls, and all sort of swing characteristics start to come out of this, again, because we want to feel like we're the top of the backswing, but our shoulders are not letting us get there without compensating elsewhere. Okay, so besides creating mobility and stability in the areas that we need, like you saw in that video, how can we prevent injuries? Well, getting clubs that are fitted, warming up properly, not starting a season off and hitting the range 5 times in that first week and hitting 100 balls each time, right? Just being smart about how we progress into the golf season and manage our playing throughout the season. Now, besides those sort of things, and our physical training in the gym, we need to make sure we're addressing these specific mobility here from shoulder to shoulder. So we want good global mobility in both shoulders, that's for sure. But we really want to highlight that adduction and that shoulder internal rotation on that lead side arm. And then the external rotation for sure on the backside arm. Okay, these 3 are really important. Again, it's better to be tested by a professional who can do it passively to you and really get a good sense of when things are starting to compensate as opposed to getting true range of motion from those joints. And then we can get a good sense of starting the process of increasing this mobility in these areas so we don't have to either A, compensate elsewhere to get into these positions, which will create a whole host of swing compensations, right? Or B, just force ourselves in these positions and start leading to pain, right? Start jamming, maybe some impingement, or those tendons start to get really flared up, or that backside, shoulder, if you have a previous labrum injury, where we start to irritate that, things like that, right? So in the gym, we're really focusing on creating some specific mobility in here and then generally recreating stability around that so that we can actively get in these positions that we need to be getting into, and then being strong there, letting the brain be comfortable there, and making sure we can do it over and over and over again and not get too fatigued, where, again, issues start to arise. Even if we have that mobility, well, if we start getting fatigued at the end of a round, now we're running back into some issues. Okay, so I got just 2 exercises here to check out that we can start running through. Kind of pretty generic, but they should be helpful for everyone. It's just that just about everyone will still need more than this. Again, check out a professional who's going to not just look at any sites of pain, right? Not just work on pain, but working on function surrounding kind of globally throughout the whole body to make sure that we aren't just rubbing the boo-boo, but we're also improving the things that are going to stop this from happening again in the future, and at the same time, certainly improving performance. So there's a lot of things here that we need to work on. Our deeper testing will tell us exactly what we need to work on, but I'd say if we're going to take a shotgun approach and we're just going to pick 2 things to work on, one would be a foam roller of the lats, and here more so the backside shoulder lats, I'd say, and for righties, that right arm side. Now, of course, we can do this on both sides, no problem there. But what this is going to be working on is when we're foam rolling the lats, is we're going to create some length through that lat. And again, lats, what they do is they will do some shoulder extension, but they also do some internal rotation of the shoulder. So if we can create some extensibility in a tight lat, we are going to give it a better ability to allow for external rotation of the shoulder, right? They like to do internal rotation, and if they're tight, they're going to stop external rotation from happening. So as we're doing the foam roller here, I want you to focus on finding those spots of really discomfort, and then I want you to just hang out on them and breathe, right? Big breaths in through the nose, out through the mouth. Feel your muscles kind of sinking around the foam roller as you breathe out. Let everything relax. And then again, I want you to roll forward and backward over those tight spots as I'm kind of doing here, as opposed to up and down. So find those spots, roll forward, roll backward, and then roll the foam roller down or up to find that new spot, and then just hang out on those spots, breathe through them. You can also take that arm that's extended overhead and just rotate that arm, palm up, palm down, palm up, palm down, like that, when we find those tight spots, and start working through our internal external rotation to really free up those lats as well. Now, another drill we can do here, this is the DNS 5-month shoulder roll. What we have here on the bottom side arm is we're going to create some internal rotation, and we're going to control that with our external rotators, and then we're doing a ton of shoulder adduction, right? So this is great for that lead side arm. So what we have to do here is first create a little mouse hole, as I'm demonstrating here. What we do to do that is try to create as much length between one shoulder and the other. So this one's trying to shoot up towards the ceiling, and this one is pushing into the ground, and they're stacked directly right on top of each other. When we're pushing them away from each other like that, we should feel this little space start to open up between our hips and our ribs there. That's what we want. We want to maintain that space and that height between our shoulders the whole time. And then we start to roll forward over our bottom side shoulder, which is at 90 degrees with our palm facing away. And we're using our left side shoulder rotator cuff muscles there to just control that motion. So nice and slow. Feel the back of the shoulder blade start to burn a little bit. What we're doing here is we're getting the external rotators to start to control internal rotation, right? They're allowing it to happen and lengthening so it can happen. And the same thing, we are allowing shoulder adduction, or that shoulder is coming across the midline, right? It's our body coming across the shoulder, but anatomically, biomechanics, and then same thing. So we're allowing in this case, our lead side arm, if you're a righty golfer, would be our left arm, to do some shoulder adduction. We are kind of creating an environment for the body to understand what it feels like to actually do that. We're creating length through that tissue that we need to allow that to happen. And then we are controlling and owning that motion because we have those rotator cuff muscles allowing that to happen and working through an eccentric contraction there where they're lengthening. Okay, so again, those are just 2 quick exercises to you can start throwing in there, and you'll definitely start seeing some gains in important ranges of motion and stability as you do that. But otherwise, that's all we got for you this week with the podcast. Again, this was taking a deeper look at shoulder pain in the golf swing and how we can assess it for either pain and injury, right, to create a rehab program for it, or just in terms of pure performance, where we lack in mobility that we can improve upon to help reduce the risk of injury in the future and improve our performance and power and speed and longevity out there on the golf course. So thank you for listening. We'll have another podcast coming out next week, and keep an eye out for the newsletter. Make sure you sign up for that so you get that sent right into your email. Otherwise, go onto the archives on the blog page. Thanks for listening.